Well, do you suffer from pain in your legs? Are you dealing with varicose veins or possibly spider veins? Well, if you are, the Vein Care Center of Amelia Island can help you with finding some relief for these things. So we have Dr. Gabor Kovacs, and he's joining us today. And welcome to First Coast Living. We enjoy having you here.
Thank you for having me here. It's a pleasure to be here.
Thanks. So tell us, first of all, let's go into what exactly varicose veins are. I'm not sure everybody knows what they are, including myself. And let's not look at my legs. Let's just talk about them.
Well,
so what is it?
Varicose veins are those enlarged veins that you can see on somebody's leg. They're usually bluish in color, and they tend to bulge and pucker up along the leg, extending usually from the thigh down to the ankle or any part of the leg. And those veins most of the time are unsightly, but also if you leave them alone, they can lead to certain symptoms. You know, usually if you have significant varicose veins, you can wind up with heaviness in the legs, pain, swelling, sometimes restless leg syndrome. Yes, it can lead to that also. It can also give you some discoloration of the skin. And if it's a real severe case, sometimes it can lead to ulceration of the skin, which is like a breakdown of the skin.
Oh, wow, that's crazy. Okay, so tell, what really causes these, though? Because you hear sometimes pregnancy in women. What exactly?
Well, pregnancy definitely predisposes you to it, or if you have varicose veins, it will aggravate it, make it worse. Mm-hmm. But the main causes are usually either genetic, which means that if your parents had varicose veins, or any family member, you're more likely to suffer from it. And then you can have occupational causes, which is if you have an occupation where you spend a lot of time on your feet standing, that's going to predispose you to developing varicose veins.
Do heels make a difference? Women wearing heels all the time?
I don't think so. No,
Okay,
I like the
standing.
heels. I like to keep the heels. That's good.
Okay, and what about, is it only in the legs?
Well, also anatomic variations can cause varicose veins. You know, when you have there are valves in the veins, and if those valves don't close properly, then that causes a backflow of blood flowing in the wrong direction, and that increases the pressure on the veins in the leg, and that leads to varicose veins.
And maybe the heaviness feeling too.
Well, the heaviness feeling, right, the fatigue and pain, restlessness.
And so is it only in the legs, though, or is it other places in the body?
Well, it's mainly in the legs, but sometimes you can develop some unsightly veins on the face, you know, some tiny red lines and small veins, and also some patients are bothered by bulging veins on their hands, but it's predominantly in the legs.
And you also conquer spider veins. What's the difference in spider veins versus varicose veins?
Well, varicose veins are usually the larger veins. Like I mentioned, those are bulging veins that you can very easily see on somebody's leg when they're standing. The spider veins are really smaller veins. They're tinier and they're more superficial. Usually they're kind of bluish, greenish in color, and they're like superficial on the skin.
And what about if someone is at home right now and thinking, I might want to conquer those? What about, does insurance cover that or not?
Well, it varies. I mean, I can't speak for all insurance companies. It varies. Sclerotherapy, which is injecting the spider veins, you inject a sclerosing solution into the spider vein.
Is that painful?
No, it really is not painful.
Okay.
It's a real tiny needle that's used. It's a 30-gauge needle. It may not mean anything to anybody, but those are real tiny needles. And sclerotherapy a lot of times is considered cosmetic by most insurance companies. So you may have difficulty getting that covered.
And then what about locations? Because you're in Amelia Island, right?
Right. We have one location, which is in Amelia Island. Yes,
And also you have an offer for First Coast Living viewers?
We do offer a free consultation. Anybody is welcome to come in for a free consultation and evaluation of their veins. We'll be happy to do that.
I love that. Okay, well, thank you so much for joining us. We appreciate having you here.
Thank you very much. It's a pleasure being here.
And we'd like to thank the Vein Center of Amelia Island for sponsoring this segment. And for more information, visit VeinCareCenterofAmeliaIsland.com, or you can also call 904-572-3074.